Thank you all for joining Food Gatherers today to learn about hunger and health, addressing food insecurity in the clinical setting. My name is Shira Dea. I am the Nutrition Projects Manager with Food Gatherers, which is the food rescue and food bank program serving Washtenaw County, Michigan. The goal of this training is to support clinicians and healthcare providers to better understand food insecurity and hunger. Through this training, you will get to know Food Gatherers and the work that we do. You will be able to describe food insecurity and hunger, recognize food as a social determinant of health, recognize the role of health providers in helping patients connect to food resources, and increase your comfort level with routine screening for food insecurity and connecting patients with local food pantry programs. So Food Gatherers is the food bank and food rescue program serving Washtenaw County, Michigan. Our mission is to alleviate hunger and address its causes in the community. We are members of Feeding America, which is the nationwide network of food banks, as well as our state association, the Food Bank Council of Michigan. We were founded in 1988 as a food rescue program and assumed the role of the county's food bank in 1997. And this truck here is one in our fleet of 8 refrigerated trucks on the road nearly every day, picking up surplus food to be sorted at our warehouse or delivering food to our pantry partners. So food rescue means we partner with local retail organizations, grocery stores like Kroger, Bush's, Trader Joe's, and they donate product that is no longer profitable for them to sell. Think about milk that has a few days before its best by date, or lettuce that might not be as crisp as the lettuce that arrived on a truck that morning. Rescued food is brought into the warehouse, sorted for food safety and quality, and then sent out to food pantries very quickly. Food banking means that we have the capacity to bring in large quantities of perishable and non-perishable food from a variety of sources, store it at our warehouse, and then distribute specific product to our agencies as needed. In fiscal year 22, Food Gatherers distributed about 7.2 million pounds of food to our community. Each year, more than 60% of the food that we distribute is fresh produce and protein. We have very high standards for both food safety and food quality, and also have an established nutrition policy that helps guide decision-making around food procurement and distribution. Food Gatherers serves an estimated 55,000 individuals through our network of 170 partner agencies and direct service programs each year. These programs provide free groceries or meals to anyone in need. We train our partners in civil rights and food safety and provide resources to increase their capacity to store and distribute healthy food. Nearly 100% of the food that we provide to our partner programs is no cost. So Food Gatherers procures food from a variety of sources. Approximately 50% of the food that we distribute is donated, with about 1/3 coming in from food rescue. We purchase about 16% of the food that we distribute, and an additional 33% comes in through government commodities, including the USDA Emergency Food Assistance Program, or TFAP, as well as FEMA. All of the food that comes into our warehouse is sorted by our incredible team of volunteers and placed on pallets. The pallets go out to our agencies or food pantry partners, and then the pantries serve the guests or clients. So most of our partner programs, or food pantries, operate in community and faith-based locations. We also have school-based pantries serving preschool and K through 12, and we partner with universities to bring free grocery programs to college campuses. Food Gatherers has partnerships with health clinics in the county as well. So when a patient screens positive for food insecurity, they can shop the pantry and are given names and locations of other pantries in our network to visit. Food pantries in health settings offer an effective incentive for patients to schedule and keep appointments, and it also provides an opportunity for clinicians to model and increase the accessibility of healthy foods that are encouraged during routine healthcare visits. In addition to our pantry program, or our pantry programs, Food Gatherers engages in direct service programming listed here. Most notably is our community kitchen, which is a licensed commercial kitchen that serves hot meals daily to anyone in need. On any given day, we serve about 25 breakfasts, 80 lunches, and 100 dinners. We are also the largest sponsor of the Summer Food Service Program in Washtenaw County, which provides free meals to kids during the summer. So the USDA defines food insecurity as a household level economic and social condition of limited or uncertain access to adequate food. Simply put, individuals living in food insecure households do not always have the resources they need to purchase the food they need. In a clinical setting, for your patients of any age, being food insecure means your patients do not have access to the foods they need for a healthy and often active life. Hunger is the mental and physical condition that comes from not eating enough food due to insufficient resources. You may hear the terms food insecurity and hunger used synonymously, but they're not actually the same thing. Hunger may arise from the condition of food insecurity, but doesn't always. So when we think about food insecurity, it's important to remember that food insecure households are not necessarily food insecure all the time. A sudden job loss, a car breakdown, or even a slight reduction in hourly work can disturb a very tight budget, leaving less money for food. Food insecurity may also reflect a need to make trade-offs between important basic needs, such as housing or medical bills, and purchasing nutritionally adequate food. We also know that food insecurity is associated with numerous adverse health outcomes and is increasingly considered a critical public health issue. In 2021, an estimated 10% of US households experienced food insecurity at some point during the year. Food insecurity affects more than 38 million Americans, including 9 million children. Rates of food insecurity are higher than the national average in households led by Black, Latinx, and Indigenous people, households that include children, and those that are headed by single men or single women. Women are disproportionately affected by food insecurity, with single mothers bearing the largest burden. In 2019, approximately 1/3 of single mothers surveyed reported food insecurity. In Washtenaw County, 1 in 10 struggles with food insecurity. This equates to about 38,000 individuals, including 6,000 children, and nearly 9% of the county's children live in food insecure households. We also know that 34% of those struggling with food insecurity are likely ineligible for public assistance. That, of course, is due to the large income gap that exists between qualifying for federal assistance and actually being able to independently afford a basic standard of living. So to run some numbers for you, the 2023 federal poverty line is about $27,000 for a family of 4 per year. So that's the poverty line. In order to qualify for most federal assistance, you have to be at or below 130% of the poverty line, which is right here. And that's equal to an income of about $35,000 for a family of 4. But in order to be able to independently afford that basic standard of living, you have to be up here. So there's this big gap. And that's where about 34% of those struggling with food insecurity and visiting our pantries are falling in. So this map from Feeding America provides county level estimates of food insecurity across the United States. The darker the green, the higher the rate of food insecurity. As you can see, the burden of food insecurity does not fall evenly across the United States, with some populations and places experiencing much higher rates than others. So as noted by Feeding America, over the past few years, growing attention is being given to the role of discriminatory systems and policies that keep certain households and communities food insecure. This map is a very helpful interactive tool that you can use to learn more about food insecurity. So check out the county where you grew up, where you went to school, where you want to live someday. When you move to a new place, pull up this map, learn about rates of food insecurity where you live, look up the food bank that serves your county, connect with them, figure out the food pantries and meal programs that are available in your community. And perhaps that food bank even has a healthcare and food bank partnership in place like we do at Food Gatherers. So we know that multiple interventions have been shown to reduce food insecurity. Broader societal level improvements in economic stability being number 1, and participation in food assistance programs also having an effect on reducing food insecurity. So these 3 federal programs here are the largest nutrition assistance programs in our country and make up our federal safety net when it comes to food. The Supplemental Nutrition Assistance Program, also known as SNAP, formerly known as food stamps, is the nation's first line of defense against hunger in America. It helps put food on the table for millions of Americans who would otherwise go hungry. There are more than 40 million Americans who receive SNAP, including more than 9 million families with children. To give you a sense of the scope of this program, For every one meal that charitable food assistants provide, places like food gatherers can provide to a household, SNAP provides 9. So we cannot lose SNAP. SNAP helps many people stretch their budgets because the money they would use on food can go towards other needs like medical bills, utilities, and rent. People using SNAP receive monthly funds through a benefits card, similar to a debit card, to buy groceries at local stores or farmers markets. The amount you receive each month depends on your income and family size. And the average monthly benefit is about $5.50 per person per day. SNAP benefits can be increased and restrictions can be waived in times of high unemployment or as an emergency response to state or national events. SNAP is a highly efficient and effective program that has been shown to lift people out of poverty and make a positive difference to the long-term health of participants. That said, $5.50 per person per day on average, or $38 per week, is not a lot of money for food. SNAP was never designed to be an entire grocery budget, but the reality is there are so many competing expenses these days that SNAP is often the only money a household has to spend on food. So just take a minute to think about how you would spend those limited dollars, $38 for an entire week at the grocery store. What would you buy to stretch your dollars? What wouldn't you buy because it was too expensive? And how do those choices line up with nutrition recommendations for a healthy diet? So funding for SNAP is reauthorized every 5 years through the Farm Bill, and it is essential for us to continue to advocate for increased funding, increased eligibility, so that a greater number of Americans can have access to this program. We also have the National School Lunch and School Breakfast Program, which provides free and reduced meals to kids during the day. And then there's WIC, which is geared towards low-income women, infants, and children up to age 5, and provides assistance to purchase nutritious foods and also provides nutrition education and referrals to healthcare as needed. With WIC, you can only purchase specific foods, things like whole grain bread, 100% juice, for example. But with SNAP, you can purchase most food or beverage. You can't purchase alcohol, tobacco, household cleaners, baby products, feminine products, but you can pretty much get whatever other groceries you need. I encourage you all to learn more about food gatherers' advocacy efforts and sign up for advocacy alerts related to food policy and food assistance, and you can do so at this link provided right here. So the experience of food insecurity can show up in different ways. We can think of food insecurity as a spectrum, and depending on the amount of financial and other resources available for food, food insecurity can affect a person and their health differently. Reflecting on this, some individuals may be constantly worried that food will run out. Others may not have enough food. Some may struggle to afford balanced meals, may cut the size of a meal or skip meals, or eat less than they feel they should. When we consider the experience of those struggling with low or very low food security, which translates to high or very high food insecurity, individuals may eat less than they feel they should, feel hungry but not eat. We might see weight loss, poor control or management of health conditions. We might see people going full days without eating. The list goes on, and this is by no means meant to be comprehensive, but it's here to illustrate some ways that food insecurity can affect a person's everyday. And what we do see consistently are spending trade-offs. So we know that across the country, food insecure households are making tough choices every day as to where to spend their limited funds. Nearly 60% of food pantry clients are choosing between buying food or paying for medicine or medical care. It's that treat or eat phenomenon. 56% are choosing between buying food or paying their utilities. 64% are choosing between food and transportation. 47% are choosing between buying food or paying for housing, things like rent or mortgage. And 28% are choosing between food and education. These are impossible choices. And what we see is that food is often the most flexible. You can change the quality or the quantity of food you buy, but you have to pay your whole rent. And this means that households are often making significant compromises to the nutritional quality and quantity of food they are purchasing in order to have enough. In fact, 88% of the clients we serve report purchasing inexpensive, unhealthy food because they could not afford healthier options. So as I mentioned earlier, Food insecurity is associated with numerous adverse social and health outcomes and is increasingly considered a critical public health issue. We know that multiple factors contribute to a person's health status, with traditional medical care being just one component. Social determinants of health can be thought of as the non-medical factors that influence health outcomes. They are the conditions in which people are born, grow, work, live, and age, and the wider set of forces and systems shaping the conditions of daily life. The social determinants of health can also be a major cause of health inequities, particularly when populations do not have access to the same resources. So examples of social determinants of health, safe housing, transportation access, education disparities, social isolation, unemployment, food. What we know is that food insecurity can affect health regardless of age, gender, ethnicity, or other demographic characteristics. We know that food insecurity negatively affects health across the lifespan among infants, children, adolescents, adults, and seniors. Individuals living in food insecure households are more likely to report poor health and depressive symptoms. They have a higher risk for chronic disease, such as diabetes, hypertension, heart disease, obesity. We see that the risk of type 2 diabetes, for example, is 2 times higher in food insecure individuals. Food insecure patients managing diet-related chronic diseases are also more likely to have lower disease control, such as elevated A1C levels. And we find that food insecure individuals are at a higher risk for diet-related diseases as well as poor health outcomes. So how might food insecurity be affecting these health outcomes? We see lower access to nutritious foods. We know that the less expensive food is often higher in sodium, sugar, and carbohydrates. We see trade-offs between food and medicine, that treat or eat phenomenon. And of course, there's increased distress and decreased bandwidth. So for these reasons, leaders in hunger relief advocate that patients be screened for food insecurity by healthcare providers. The Hunger Vital Sign is a validated 2-question screening tool to assess food insecurity in the clinical setting. In addition to finding patients who need resources, implementing a universal screening tool helps make the issue of food insecurity much more visible and also emphasizes the importance of access to food on health. So I'm going to read you the questions. The first of the 2-set question is, we worried whether our food would run out before we got money to buy more. Was that often true, sometimes true, or never true for your household in the last 12 months? And the second question is, the food that we bought just didn't last and we didn't have money to get more. Was that often true, sometimes true, or never true for your household in the last 12 months? A response of often true or sometimes true to either question is an indication of food insecurity. But what do we do with a positive screen? How do we make effective referrals for food insecurity? So the first thing to remember is that many patients may feel embarrassed or ashamed about not having enough money for food. As much as clinicians can use a positive, non-judgmental, solution-based language, the better. For example, thank you for sharing that with me. Many of my patients struggle with the same issues. We can help. You're neutral, drawing connections with others, letting them know you can help. Another thing to remember is that while the screening tool is an excellent aid to assessing food insecurity and a great first step, it may not capture everyone. So in addition to the tool, normalizing and routinizing conversations about food insecurity can help identify patients who didn't screen positive. It also helps patients feel less singled out, as if there was something about them in particular that made you ask that question. So for example, I ask this of all my patients, do you have trouble getting food sometimes? The more routinely you ask this question, the more comfortable you become having these conversations, and that can help your patients feel more comfortable too. If you have any personal experience with food insecurity, it's absolutely okay to share your story with patients, or at least parts of your story. And if you volunteered with food gatherers and some of our partner food pantries, you know a few things about how the pantry works and what a pantry looks like. So in Washtenaw County, if you say you need food, you are eligible. You don't need dependents or disability or to provide proof of income. You may be asked for ID, but you can remain anonymous if you choose. And these processes are things that you can share with your patients to help them feel a little bit more comfortable walking into a food pantry for the first time. Lastly, it helps to offer your health perspective to encourage patients to shop at food pantries. Tell them about the variety of healthy foods they can get at a pantry for free. Things like fresh fruits and vegetables, meat, milk. Also remember that patients may need both short and long-term food assistance. They may need a pantry. They may also need help connecting to federal food assistance that supports them and their families. Things like WIC or SNAP or that summer food service program that I spoke to you about earlier. As much as we can leverage federal aid and local food resources, the better for the entire household. In Washtenaw County, if you have a patient that's looking for food and a food pantry, you can find one of our partner food pantries by visiting us at foodgatherers.org and find food. I'm just going to take you to that website right now. So this is our Find Food Map and List. As you can see, you can either peek at all of our pantries using this map function. You can filter it by program type and either look for a food pantry or a free meal, depending on what your patient might need. You can filter it and add delivery or SNAP application assistance, depending on their needs, or even check off the day of the week that you're looking for. I always really like to go directly to the food list whenever a community member calls looking for food. So for example, I might open up Ann Arbor and do a search and find for Monday. And then I will see that there is emergency grocery delivery today between 9 and 12 for Ann Arbor Community Center. Bryant Community Center is offering meals today groceries today between 10 and 3. So that's right here. They have a food pantry. The community kitchen is offering meals today, both lunch and dinner. And so through that function, you're just able to sort of search through and depending on what day it is, figure out what pantries are open. If you do have patients that are looking for support connecting to federal nutrition programs, this is the link for SNAP. Of course, I would never expect a physician to be looking at this map and helping people connect to SNAP. I have had medical residents and students talk to me about wanting to help their patients immediately find a food pantry, which is why I'm offering you that information right now. So in addition to that, it does make a lot of sense to set up your team so that patients in need can be connected to caseworkers and skilled outreach workers for immediate and long-term food support. Handouts and flyers are not very effective on their own, but if you are offering them other information and sort of that more personal referral, you can of course hand them information that's written down for them to more clearly keep it organized in their minds for later. I think it's also really important to follow up with patients at future appointments and ask them if they found the resources that they need. And then, of course, if you're screening your patient population for food insecurity and you find that a high percentage of patients need resources, you can also consider direct food distribution. Lastly, here are some tips on how to join the fight against hunger. So number 1, screen patients for food insecurity using that hunger vital sign. Number 2, visit us to learn more about the work that we do. So again, you can find us at foodgatherers.org. Advocate for continued funding and increased eligibility for SNAP and other federal programs that fight hunger. You can sign up for advocacy alerts at foodgatherers.org/advocate if you're local. And if you're joining us from outside of Michigan, visit Feeding America and sign up there. You can also review resources from Feeding America that map the meal gap. Again, it's just to find out what the rates of food insecurity are like, depending on where you might be in the country. And there's other great organizations such as the Food Research and Action Center, which do a lot of education and just information related to food policy, food assistance. And so it's a really great place to start. Thank you again for joining us today. If you have any questions about this presentation or hunger and health and food insecurity, please reach out to us at cfp@foodgatherers.org. Thanks.